The provincial government is making sweeping changes to COVID-19 measures. Following a press conference postponement earlier this week, Ontario's top doctor returned, announcing the return to school, new testing and isolation rules. Jason Gaidola joins us with the latest. Jason.
That's right. Dr. Kieran Moore says they will mirror the CDC's recommendation, and only two-dose vaccinated people and their household contacts will only be required to isolate for 5 days. He also mentioned that symptomatic high-risk individuals will be the only ones to have access to publicly funded PCR testing, and schools will return next Wednesday. Schools across Ontario are given an extra 2 days to prepare for the return of students and staff.
Already given direction on testing before the return, so we have that safety buffer to ensure children don't return to school who test positive. We also have modified and changed our screening tool to ensure that it additionally monitors for symptoms on a daily basis.
Ontario's Chief Medical Officer, Dr. Kieran Moore, says with 11 million rapid tests distributed, families are equipped to screen for COVID-19, and classrooms will see more N95 masks and thousands of HEPA filters.
Kept it a couple more weeks, to catch up with more boosters, and so it's not bad.
A little bit more notice from the government. If it sounds like something wasn't really something that was decided on the fly.
With another daily case record tied to the surge of Omicron and limited testing capacity, starting tomorrow, the province is cutting back on publicly backed PCR tests and will only administer to symptomatic high-risk people. Even individuals testing positive on a rapid antigen test are not required to confirm the results.
If we had the capacity, we would offer the testing. This is a finite capacity.
Public Health Ontario released a study saying that the risk of hospitalization or death with the Omicron variant is 54% lower than Delta. Following this week's announcement regarding a shorter isolation in the U.S., effective immediately, provincial health officials are axing the 10-day isolation period down to 5 days to those who have at least 2 doses, their household contacts, and children under 12. More states' evidence is showing cases are most infectious in the 2 days before and 3 days after symptoms develop. Epidemiologist with Ryerson University, Tim Sly, believes the data is strong at this point.
And then following that, the virus load drops off, your infectivity drops off, and your symptoms you still then suffer from are caused by your own immune response system. Well, then you could go back with some precautions and some margins of safety.
90% of your viral risk of transmission is already transpired by 5 days.
Some school boards across the province have pushed their start dates for staff and students to return to class. The District School Board of Niagara say they will start on January 10th. Jason Gaidola, CHCH News.